sitting here making eggs for our friend from Wales, Winford. He doesn't eat right at home, so we have to fix him up. So when we send him back, he will be fat and happy, ready to save the country of Wales from the horrible depths of the disease of addiction and alcoholism. We are dealing with the mainstream saint here, Winford from Wales. And it has been a sheer pleasure and blessing to have you here. You have certainly made things go a little smoother in Richmond, Virginia. A couple more days, I would have had you fully trained to take out the garbage, do the dishes, and other things that are important to early recovery.
And that's, in a nutshell, the philosophy behind McShin, isn't it?
McShin basically is a spiritual, mental, physical organization run by a recovery board of directors. You got to have a little bit of clean time to be on the board, but not too much. We don't want to spoil our staff. But the same principles of the program, you know, everybody participates, everybody does their fair share. You know what I mean? We take care of one another. Most important, we provide an atmosphere conducive for recovery, a nice recovery environment, and seems to be working real well.
And you're different to all the other providers I've seen a while in America, John, because you don't receive public funding, don't you?
Well, no, we don't. You know, we like to sell services to the public, but we want to sell them the way they should be done, not the way they want us to do them. See, the reason we're in the problem we're in is because the people in charge don't know what they're doing. So why take money from somebody who don't know what they're doing? You know, we need to tell them what to do and how to do it, and that's what we're slowly learning to do here. And that's probably why you see a little bit of different system of care here than anywhere else you've been. You know, anybody, anywhere that needs help, we want the hand of McShin to be there. Now, granted, as time goes by, we'll get better at what we can deliver. As you can see, you have me moving quick here with these eggs. We like them just right here. All these little chickens that died for our breakfast, we want to make sure they die not in vain, but for a good cause. So the eggs got to be just right. See, that's just enough for everybody to have their fair share. Just like a principle in recovery, their fair share. Now, Winford, make sure these are sitting pretty. We'll be right back for those. I have to get the bacon off the grill.
Okay.
That's a little different operation out here.
But I suppose the way you've been able to do it, John, is through having...
You like burnt bacon?
Wow, look at that. Recovery homes?
Yes. You got to have housing for your people. You don't have housing. You like burnt bacon?
Yep.
That's what we're having this morning, burnt bacon. But you got to have housing for people, you know. Most newcomers, they need a safe place to live. They need to feel like they're earning their own keep. And they need recovery people to be around them trying to help them. And that's what we try to provide here.
And that really is the backbone of your sustainability.
Exactly. Well, burnt the bacon. What we got, egg? I didn't burn the biscuits, I didn't burn the egg.
It's a dish we're very good at doing back home now, the burnt bacon.
That's right. Well, we won't make you feel at home, so.
Yeah, exactly. You're going to feel right at home this morning.
There's Carol over there. Can you see Carol? She's be conscious of the fact she's now dressed. Still in her pajamas.
That's right.
Morning, Carol.
Good morning. The work that I do in Washington to advocate for individuals seeking recovery fits nicely with the work that we're doing here to make recovery available in Virginia. And we've gotten 2 significant accomplishments in the states in the last couple of years, since 2008. First, we got a law passed called the acronym is MPAEA, and it stands for the Mental Health Parity and Addiction Equity Act. And that's a law that will require insurance companies to treat addiction and mental health like any other medical condition covered under health insurance. And then after that, in 2009, we got passed what's called the Affordable Care Act, which is our big health law. Probably not so much hot news in the rest of Europe, but we finally got, health care for everybody here in the United States. But now becomes, when you get a law passed in the States, it doesn't mean anything until you get the regulations passed to implement that law.
Right.
And we're on that work now. And one of the things that we're doing is we're actually writing the addiction benefit that all Americans would be eligible for. And we are, for the first time, considering putting in the benefit that all Americans would be eligible for, peer-based recovery support services. So that's how what I do in Washington fits in with what we're doing at McShin. Because we don't receive public sector funding like so many of the other recovery community organizations that you visited, we have to look for other ways to get our sustainability. And one of them that we're anxious is that when the bulk of the health law goes into effect in 2014, and when people will be able to get their private health benefit and their expanded Medicaid benefit, which is for the indigent, and the private health insured benefit through these new state exchanges, they will have peer recovery support services available.
And they will be able to buy services then?
That's correct.
That's
and so what we've been working on in Washington is making those mandatory as available services under both the private health insurance and under Medicaid. And we're very, very close to getting that done. So the first step is to get the Substance Abuse and Mental Health Services Administration to recommend it, and then they have to recommend it to our Health and Human Services Department. So we think we've got it in SAMHSA's benefit, and now we have to get HHS to sign off on it.
Brilliant, thanks.
Our system of care is designed to, if you can just shake out the ones who have it, get them to pay their fair share, that's usually enough to handle the costs, all our costs. So as far as McShin goes, the only money that varies, I don't get paid much, I don't get paid often. But if we have an abundance of money, I can certainly get paid. And my staff gets paid. So it works out good, but you have to be able, like I said earlier, you need to be able to provide safe living, safe community, jobs, a lot of things, peer counseling, sponsorship, coaching, mentoring, and help the family. The families need help. The society is not helping the family. They don't want their loved ones to go to jail and prison. They want their loved ones to get recovery. So our system is designed to deliver services to all those seeking or needing services with substance abuse, alcohol, drugs. And then the ones that are serious benefit the best. And if you're not serious, then you will end up in jail, dead, or prison. So we have a system set up today that is to kill everybody or put them all in jail and prison. So we want to implement the recovery system of care, and that way we can hopefully cut down our death in our jails by 50%. There's still going to be a bunch that aren't going to make it, but our system needs to be designed to service those who are capable of making it. So we're trying to help the ones who can make it. But we don't know which ones can make it, so we just help them all and let God sort them out. You know the old saying, you can't predict who's going to get it and who isn't. But we stay clean in the process, so it works out pretty good for everybody. Eat your breakfast.